You're tuned to Planet Vero Radio. I am Cindy Schwartz. We are broadcast on iHeartMedia, and we are also podcast on Spreaker. My co-host Jeannie Rodler is on Skype with me from Indiana. Today we're talking about medical people's opinions when you ask on different platforms, when we have asked on different platforms personally, questions, why do these things have to be done, doctor, nurse, whoever we're addressing, and they come back with their opinion, which is totally valid. Everybody is entitled to his or her opinion, absolutely. And we question it and we say, well, I didn't know that. Is there more information? I really want to make a decision based on the criteria of what I think I can withstand. Can you give me all the information? And we get some of these opinions back that are, really saying, well, it's this way and that's it. You don't have any input in any of this. And some of the questions I want you to say, Jeannie Rodler, and some of the answers that were given so we can discuss it, because personally, we have other ideas. We're not doctors. We're not lawyers. We say that all the time on this podcast. But we have been patients in serious situations, and we know that so-and-so and so-and-so are a couple of things we'd like to address and ask for what the actual facts are for that particular operation, procedure, or whatever, and maybe go elsewhere. And that's when we run into these problems. So go ahead with some of the things that you've found out.
Well, I was in a conversation with this RN. She says she is an RN of 40 years. And first of all, she said bodily dignity is not that you can wear special garments to cover up your private areas. It means you're covered and given privacy. Well, that's not exactly bodily dignity. If it doesn't need to be exposed, it should never be uncovered to start with. That is bodily dignity. So, she doesn't know what the definition is. That's clear. She went on to say that they see millions and millions or thousands of different body parts, and it doesn't mean anything to them. But in the same breath, she went on to say that if there is something unusual, then they'll ask to take a look. So, is it or isn't it? She needs to make up her mind. Are they looking or not? Apparently, they do look.
So you mean we're talking about intimate procedures, or maybe the genital area is uncovered, say for foot surgery or say for hand surgery. So that's what we're questioning. What was the question that you actually asked her, Jeannie?
Well, the question was, why can't female patients wear a garment, a surgical garment bra during a procedure? And she said, absolutely not. It's not about modesty. If you're thinking about modesty, then you're immature. There are no such articles of clothing that could be worn during surgery, which is totally not true, because there are several garments made especially for surgical procedures, and there is a bra that is made especially for women to be able to wear during surgical procedures.
Mm-hmm. Yeah, there's actually a couple of them. Yeah, absolutely.
And she said, no, that can't happen, because once they're out, the garment is opened and put on, it's no longer sterile. Well, so if we follow her reasoning, the reasoning be once they open the drapes, they are no longer sterile either.
You mean the surgery drapes?
Yeah, the surgery drapes.
Mm-hmm.
So, she just kept with all these excuses that really made no sense, but these are the typical excuses you get from them when they're arguing something they know they cannot win because there's no sound reasoning.
So there's a couple of points the two first points that I want to make about the garments. There are surgery-specific garments that have been invented, one by a doctor at Mayo Clinic, another one by a doctor that practices, an orthopedic surgeon that practices in the Chicago area, specifically made for female patients to cover their breasts when you have one with shoulder surgery. The other one is, why can you not wear some kind of, it's a tube-type Velcro closure bra accessory that for foot surgery?
Right.
And why do you have to be naked, completely naked, to have your foot surgery done? Why do you have to be completely naked to have, a finger surgery or even brain surgery kind of thing. Some of the doctors will argue because we want to have immediate, if something happens, immediately access to the heart, the vena cava. Again, I'm not a doctor, so I don't know all the explanations, but that's their reasoning behind it. We just whip off the sheet and we can get right at you. Well, if these other doctors, and this stuff was invented by doctors, are saying that that's not necessarily true, that 99.99% of the time there is no reasoning to have all this exposure, anesthesiologists included saying this, and other doctors all over the country can perform these procedures without that being done, then that argument really, in my opinion, doesn't wash, because it can't be about germs when Dr. Q, Dr. L, Dr. W, whoever you want to name, is doing the same procedure without having that person completely stripped naked.
Right. And, this nurse went back to say that, and basically, that since we were giving this information about the surgical garments, that we were immature and that we were spreading misinformation, and that we were liars, which, goes back to the same old thing that they always revert back to. When they can't win, then comes the personal attacks, because they know these things exist. Why hospitals will not use these garments is beyond me, because it's really no cost to them. Well, so I don't understand. Many people don't understand why these garments aren't just handed out to surgery patients. So I guess the question that we're asking as patients, then that particular person working, being employed by a certain facility, wherever that is, these are that facilities and that person's rules, or however that dynamic works. So then we say, okay, tell us, and we'll go somewhere else. Because we know that these other doctors can perform these procedures. So don't tell us that this is the gold standard of care. And I quote that because I've been told that many times on procedures that I asked about, and immediately, this is our gold standard of care. Well, okay, that's just lip service is all that is, because you're not really telling me what's going to happen. And now we're back to the informed consent and the patient rights. So if Dr. Q at the Mayo Clinic can use this surgery-specific, completely designed and passed by the FDA, the materials and everything, and has no side effects with it, has no germ issues, anything like that, and is completely successful, then don't tell us it's not successful, and don't revert it back, like you say, Jeannie, that it's a personal issue. Oh, you just don't want to be naked in front of us. I mean, that's just asinine to say that. It is. It really is. There is no reason. Most people, when they go for a procedure, they have no idea that they're going to be stripped naked. I mean, why would you think that for shoulder surgery that you're going to be stripped naked?
And kept naked. I want to add that, and kept naked.
Yes. So most people feel violated afterwards if they find it out. And it erodes the trust that you have in the medical profession when this type of thing happens. Most people will never, ever trust them again because they feel so violated. Well,
now, specifically those actual people, I mean, to say it across the board, that's kind of a stretch, but those particular people, if you know that that's what we're doing. The other thing is that I question too, and I have interviewed anesthesiologists about this, is you're a patient, you're already compromised because you have some kind of reason why you have to have that procedure. You're nervous, you're scared, absolutely scared, you're anxious and whatever. Now you put the person in a 60-degree room and they're completely naked. Now, you tell me that isn't a factor as far as body heat and as far as your body trying to compensate to keep the warmth so it doesn't go into shock or hypothermia or whatever. I mean, that's just kind of common sense. I don't really have to be a doctor to know that stuff. And so it does happen.
Well, yeah, and there are studies that back that up, that people who are cold during the surgical process are people who are less likely to heal or recuperate as quickly as what they should.
Yeah, there you go. So you've been listening to Planet Vero Radio. It's another episode of Patient Partners. We were talking about some of the things that, we do ask people for their opinions in the medical field, and these are some of the opinions that we've gotten. So please stay tuned to Planet Vero Radio.